Dr. Shankara Chetty from South Africa was recently interviewed, and he gave an insight into one of the most remarkable observations that I have heard clinically, and that is the principle of the 8th day deterioration for patients. Listen to him share from a short section of our video this most incredible clinical observation.
Very soon into the pandemic, I realized the importance of the 8th day and what was transpiring on that day. So very quickly, the community were informed that if they develop any flu-like symptoms, they need to report it immediately. And so I had floods of people coming in with flu-like symptoms that I needed to assess and decide how to treat this. So I think my community was very well educated from the start not to be fearful. After all, we are in charge of taking care of people's health, be it emotional, be it their physical health. And I found that the fear around the pandemic was going to cause problems. So I had to provide my patients reassurance, even if it was going to challenge my own existence. I'm passionate about what I do, and so I think that I needed to do what needed to be done. That the breathlessness always occurred exactly a week after the onset of illness. And I found this strange. I went back to my records and looked at those five patients very clearly. Yes, I had patients who hadn't had any symptoms post 7 days. But these 5 patients presented on exactly a week after the start of their symptoms. So I knew that the allergic process was being initiated on that 8th day, a week later. And it almost occurred to the hour. I had patients who developed symptoms in the evening on a Monday, would phone me on a Monday morning a week later to say, I'm feeling perfectly fine, I must be over this. And I'd say, please, just wait a few days just to make sure you're fine. And without fail, they'd phone me that evening to say, I got body aches and pains again. And they're in the hypersensitivity phase of this reaction. Look, hypersensitivity was a consideration, but never something that I considered from the start. I knew I was dealing with an allergic process. What drew my attention to hypersensitivity was I knew that steroids would need to be started on that 8th day, because that's the trigger of this allergic process. But I did not understand the nature of that allergy. And I knew that it was a new process, because I've had patients having flu-like symptoms for a day and improve. They spend the next 6 days perfectly fine. I've had patients play sport and things in that time. But exactly a week later, presented back with sudden onset of dyspnea with saturations that dropped to 70% within that day. So it triggered my, it brought an understanding that we were dealing with something that was occurring on that 8th day. So I started treating it with steroids.